Tuberculosis remains the world's deadliest infectious disease, taking the lives of about 4,000 people each day. About 1/4 of the world's population has latent TB, and infected people have a 5 to 15% lifetime risk of falling ill. TB has a devastating impact on development and exacerbates poverty, which places economic and social strains on individuals, families, and communities. Fighting this disease that causes millions of people to suffer and die each year has not been easy due to several factors: delayed diagnosis, weak laboratory services and healthcare, high-risk comorbidities, challenges of drug-resistant TB, DRTB. United States Agency for International Development, USAID, leads the U.S. government's global TB efforts by working with international agencies and partners around the world to reach every person with TB, cure those in need of treatment, and prevent the spread of new infections. In 2010, USAID launched the TB CARE II project, implemented by URC and partners, which aims to provide global leadership and support to national TB programs and other stakeholders to accelerate the implementation of TB, TB-HIV co-infection, and multi-drug resistant TB services, while focusing on innovative technological approaches to improve TB case detection and treatment, with a particular emphasis on interventions related to infection control and programmatic management of drug-resistant TB. From 2010 to 2020, TB CARE II developed, implemented, and scaled up innovative TB interventions at the national, regional, and global levels. USAID TB CARE II provided technical support to the high TB burden countries, including those prioritized under the U.S. National Action Plan for combating multi-drug resistant tuberculosis, implementing in the following countries: To fulfill the global venture, URC's strategy for implementing project activities is based on key core principles. TB CARE II has contributed to successful design and implementation of interventions to assist countries in their fight against TB. In Bangladesh, TB CARE II worked at the national level, and in 39 districts, the project piloted and scaled up innovative models for community-level TB service delivery, engaged non-governmental organizations, NGOs, and the private sector to accelerate TB case finding, supported the integration of TB services with diabetes, HIV, and maternal and child health, MCH, and strengthened the overall health system for aid TB service delivery. Understanding barriers to diagnosis and treatment from research to practice. Community engagement in TB case finding. Active case finding and infection control at health facilities. FAST. building health provider capacity for diagnosis and treatment, strengthening laboratory networks, improving adherence to MDR-TB treatment, mHealth treatment support, integrating TB with HIV and diabetes services, in Malawi, TB CARE II worked to expand and solidify achievements, especially around increased case finding, decentralization of TB and MDR-TB services, and improvements in TB-HIV integration. Engaging communities in TB control. Expanded TB case finding at health facilities. Strengthening the laboratory network to support TB diagnosis, decentralizing TB registration and treatment initiation, promoting integrated TB-HIV services, addressing multi-drug resistant TB, TB CARE II made a strong contribution to strengthening TB control in South Africa, increasing demand for TB treatment, improving case finding and management of TB in children, strengthened MDR-TB case finding and management. Thanks to USAID, millions of people were reached with TB messaging and thousands screened and tested for TB and HIV. Since 2000, USAID and its partners have saved more than 58 million lives globally. USAID TB CARE II has reached its goal for the year 2020 by developing and scaling up innovative models and providing targeted technical assistance to the countries with a high burden of TB in accelerating progress toward ending TB. USAID continues to lead the U.S. government's global TB efforts to reach every person with a disease, cure those in need of treatment, and prevent the spread of new infections and the progression to active TB disease, and to accelerate their responses to end TB while ensuring they are progressing on the journey to self-reliance.